Hi, welcome to my second video. We were talking about cancer and we looked at the risk factors, we looked at what cancer is, and we looked at even the direct causes of cancer. I want us to go and look at prevention of cancer. Now, the prevention of cancer is very easy. If you want to prevent cancer, then you have to prevent the risk factors. I have to appreciate that some risk factors cannot be prevented. For example, age, because the more you age, the more the risk of cancer. Another risk factor that you cannot prevent, maybe I may not have mentioned in my previous video, is about family history, such that there are some cancers which are associated with family history, like breast cancer, cervical cancer, such that if a relative whom you are related by blood had that cancer, then the risk that you will also get the cancer is very possible. Now, to prevent cancer, first prevent tobacco use, either by chewing tobacco, smoking, in whichever way you consume tobacco, you prevent it. And this also includes secondary smoking, which is a leading cause of cancer. Remember, secondary smoking is more toxic than primary smoking. And the second one now is reduce or moderate alcohol intake. And actually, as I said earlier in my video, a man need to take a maximum of one drink per day, and a woman need to take a maximum of two drinks. No, the other way around. A woman need to take an average of one drink per day, and a man need to take an average of two drinks per day. The CDC has also defined what a drink is. So, there is issues with concentration of alcohol in beer, in wine, and in spirits, what we call whiskey, which is not the same, which is different, which is varied. Then another way is to cut on weight by doing physical exercise, by eating a healthy diet, so that we cut on weight. So that means physical exercise, another way to prevent cancer as well as weight reduction. Another one is actually, vaccination. We have some viral diseases, especially, which have been implicated to cancer. This one I did not mention in my previous video, but for example, human papilloma virus has been implicated to cervical cancer, and hepatitis A, B, C, all those viruses are implicated to hepatoma, or what you may call in layman language, cancer of the liver. And we even also have other viruses which also can cause cancer. HIV is one of them. So HIV/AIDS has been shown to be a direct cause of cervical cancer. And so some of those viral conditions, they have vaccination. For example, hepatitis B, C, all of them have vaccination. Um, I'm not sure if we have vaccination for human papilloma virus. The other way is actually early screening. Early screening, before cells develop into malignant cells or cancerous cells, there is usually a certain stage when they start showing early signs of changes that are related to cancer. So once the cells are detected in that early stage that they are anatomically or structurally different from normal cells, then before they even develop into cancerous cells, they are able to be either removed or handled by radiotherapy or some form of other treatment so that they doesn't progress into cancer. So, and then we have others like, the environment where you live. You can actually have powers over the environment you live. Remember, polluted environment increases the risk of cancer. So you can try live away from polluted environment. Think of also diet. Avoid unhealthy foods. Unhealthy foods include, diets which doesn't have protein. Rather vitamins, and that means you need a good or a lot of fruit diet and vegetable diet, and of course from a healthy source. Then avoid certain tasks which can expose you to cancers. This is very common for occupational cancers. For example, there are tasks like mining, working in agricultural sector, welding, grinding, all those tasks, they are closely associated to cancer, because carcinogens, various, like for example in farming or in agricultural sector, a good example will be a flower farm, where there's a lot of chemicals that are used, during the growth of those plants or those flowers, and also during the preservation of those flowers. And these chemicals, people get exposed to them from the environment. So the more you avoid such kind of tasks, the more you reduce the risk of those cancers. You have many other ways to prevent cancer, including the use of, like in the workplace, you can use, the right personal protective equipment, and that you'll be avoiding preventing those cancers. Now, the treatment of cancer. Let's look at the treatment. Cancer is handled in around 5 ways. The first way is chemotherapy. Chemotherapy is where certain medicines, which you call cytotoxic drugs, are given to kill cancer cells. Um, and Unfortunately, these drugs, they also might kill your mature body cells. And usually, when people start treatment, they get a lot of complications, especially on those fast growing cells like the hair, the skin, the mucosal surfaces. So those cells get a lot of effect. That's why people start chemotherapy. Some of them turn dark, some of them lose their hairs, and stuff like that. Now, the second form of treatment is radiotherapy, where you use radiation, X-ray radiation, to kill cancerous cells. And the third form of treatment is surgery, whereby the cancerous cells are actually excised, they are removed by surgery. And then, of course, the fourth one is palliation, where there is all this supportive treatment. There are some stages like stage 4 cancer, whereby now the treating that patient and not treating that patient is 50-50, or maybe when the treatment is more dangerous than not treating that patient. So instead, you offer a lot of supportive treatment. And then there is nutritional support, whereby you give the right nutrition to support the health of this person. And this includes a lot of foods that have been recommended for cancer treatment, cancer management. And then, of course, psychological counseling and psychological support. You can imagine, like, young ladies who get cancer and start chemotherapy, and all of a sudden they are losing their hairs, including the hairs above the eyes, and it's just very disturbing. Some turn very dark, some of them just get a lot of cosmetic problems. So it is necessary to ensure that these people get the right counseling without lying to them. You prepare them psychologically, slowly, and usually a medically trained or a counselor will always do this job much well. So that is the way we we actually manage cancer. So just to review what we discussed about cancer. We said cancer happens from mutation that occurs right away from the level of the genes, which is found within the DNA, which is found within your nucleus, which is found within your cells. And then this leads to abnormal growth of cells. So the programmed cell death and cell growth doesn't happen, what we call apoptosis, programmed cell death. So instead, these cells grow continuously, and they accumulate, and they start infiltrating into normal cells, and then you lead to masses, and all these consume a lot of sugars, and people start developing a lot of problems. Then we spoke about risk factors, which spoke about smoking, cigarette taking, or rather tobacco use, issues with the weight, the lack of physical exercise, age. We talk about family history, talk about even sex. Maybe I did not mention that. There are some cancers which are common with certain sex, like for example, breast cancer is common with women than men. We talked about risk factors like environmental pollution, risk factors like certain tasks, risk factors like stress, night shift work, which has been implicated to breast cancer. and lack of the right diet, especially if you avoid vegetable and fruits, which you really need to prevent the cancer. Then we spoke about treatment, which you spoke about palliation, of course, to begin with, chemotherapy, radiotherapy, surgery, palliation, nutritional support, and you have mental or psychological support. Um, um, and all this harnessed together, I find it very useful information for you that might give you basic understanding of what cancer is, and who knows, maybe it will help you check yourself. However, remember there are so many forms of cancer, more than 200 forms of cancer, and each of them have specific information that relates with it. So, for example, breast cancer risk factors may not be exactly the same as esophageal cancer, may not be exactly the same as cancer of the bone. So that will be very, very much varied. There are also different types of cancer, those that affect skin, connective tissue, those that affect, the let's say, the nervous system. So all those we look in our subsequent videos. Thank you very much and welcome again. If you like my show, please subscribe to it, and I'll be doing more of these videos again and again. Thank you.